Hey everybody, I'm Sean Duhamel from Mass Retirees. Welcome to our weekly update. Today's Friday, November 7th. I'm going to talk primarily about healthcare today, but I also want to update you just on a few other things that are going on with our association, starting with the fact that we have two more area meetings coming up for the remainder of 2019. Every year we have 16 or so meetings across Massachusetts, along with a handful, 3 of them now, down in Florida to attend to our Florida members. And we have 2 more left, one being in 2 weeks down in Westport at Whites of Westport again on Friday, November 22nd. The meeting starts at 11 a.m. It's one of our larger meetings. If you are in the southeastern Mass area, please come on by and say hello. It's one of my favorite things to do, is get out in the field, directly talk to our members, hear from you, answer your questions, and being able to put a name with a face. It is great. So come on down. Following that meeting, our final meeting of 2019 is in Central Mass at the Arbor and Elks, also at 11 a.m. Super convenient location if you're anywhere in the Worcester or Central Mass area. Come on by. It's the same format. We have door prizes, we have Q&A. It just gives you an opportunity to meet with us directly, see that we're real live human beings. If you have any complaints or suggestions or concerns, you can speak with one of us one-on-one, and we'll do all we can to help you out. Just as long as it's an issue directly related to public retirement and your health insurance and those sorts of things, we'll do everything we can to help you out. Before I get into what's going on with healthcare and what's heating up in terms of healthcare policy, I just want to recap where we're at in terms of the windfall elimination or Social Security WEP reform legislation, which of course is HR 4540. And we've been talking about this now for forever, but in terms of HR 4540, this bill was filed about 6 weeks ago by Congressman Richie Neal from here in Massachusetts. Right now we're approaching 50 co-sponsors from what I understand of the legislation, and the momentum that continues to build around this legislation is because of the work that you're doing. You're answering our call to contact your local member of Congress and ask them to get behind this legislation, and it's making all the difference in the world. So again, if you haven't already done so, please take a moment, contact your local member of Congress, specifically ask for 2 things. One, that they become a co-sponsor of HR 4540. That's Richie Neal's bill. The second thing we need to ask them is to please make WEP reform a personal priority for the current congressional session. Now, we all know there's a lot going on in Washington, D.C. right now. Those things are beyond our control. We're not involved in it. We're not taking positions one way or the other. Our focus is strictly on working for you, helping you, and making sure that this legislation doesn't get lost in the shuffle. Now, we've gone down that road before in previous years. Right before the 9/11 terrorist attacks in 2001, the opening stages of the George W. Bush administration, there was some interest in doing some Social Security reform back then in regard to WEP and GPO. 9/11 happened, it changed everything, and it pushed this issue right off of the radar screen. And we need to make sure that regardless of all the other important things that are going on right now, the focus stays on bipartisan efforts to help you, and that's what HR 4540 stands for. And we'll have a more up-to-date update a week from now with other information that's happening with that legislation, but that's where we are at for today. Now, the focus of today, I want to talk about health insurance, because right now is when the planning starts to take place for next year. Things are always happening in advance, and next July might seem like a lifetime from now. But in terms of public policy and healthcare policy, it's really a blip in time. Right now, both the state and cities and towns across Massachusetts are looking at their budgets for fiscal year 2021, which begins on July 1st of 2020. Confusing, yeah, I know. It's keeping up with all these dates and particularly calendar changing. It's very confusing, so just bear with me for a moment. But this fall, in November, where we're at right now, is when the planning really gets underway. Right now, we are not anticipating any dramatic changes anywhere across Massachusetts with your health insurance plans. But we can't be sure of that. And we can never just sit back and assume that we're all set, because the minute we start to do that, all heck is going to break loose and bad things are going to happen. So we got to stay on top of what's happening in terms of health insurance, because it's really the one area where we have the most vulnerability with your benefits. Changes can be made to your health care plans, and they're not usually good changes. So right now, the State Group Insurance Commission, they are meeting on Thursday, November 21st, and we should start to get somewhat of an idea at that point of what the GIC is considering for next year. Those plans will come together in December and January and early February, and by the mid to late February, and certainly into March, we'll know what the plan design is going to be, we'll know what the co-payments and deductibles are going to be, and we'll know what the monthly premiums that you're going to be charged are going to be by March. All of that's going to happen pretty quickly. Cities and towns will then look at what the state has done and in many cases mimic what the GIC is doing and take action very quickly. So we are closely monitoring, and we will be present at all of these meetings here in Boston regarding the GIC. But what I need to ask you to do is keep an eye on things locally for us. If you hear of something happening in the community that you live in, even if you're not retired from that city or town, let's say you're a state retiree, but you live down in the town of Plymouth, and you hear about changes taking place in Plymouth that would impact Plymouth retirees, reach out, give me a call, give Cheryl or Bill or Frank or anyone in our office a call, or just send in an email and say, hey, you may already know about this, but just in case you don't, here's a heads up. Sometimes we already know about it, but oftentimes we don't. And if we receive advance notice, we can then reach out to our local members and engage them in the process, and more often than not do a pretty darn good job of defending our local retirees if we have advance warning. And those are the kind of things that are going to happen over the coming months. Now, the big focus for us in terms of healthcare policy, and we've been saying this over and over again, is affordability, particularly for our non-Medicare retirees. There's not a day that goes by that we don't hear from one of you who's not eligible for Medicare. And right now at the state level, believe it or not, there are 34,000 retirees who are not in the Medicare program. And guess what? Those 34,000 retirees are in the exact same health insurance plans that all of the active employees are in, paying the same co-payments, the same $500 a person or $1,000 per year for the family deductibles as the active employees. And as tough as it is for the active workers to be paying these costs, it's even worse for retirees living on a fixed income. And something needs to be done about that. We are doing all we can to encourage and work with the GIC to see if there is a way to enroll those retirees into the federal Medicare program with everybody else. There would be no $500 a year deductible. There's only a $10 copayment for a doctor's visit. So the out-of-pocket costs on Medicare are dramatically lower than what our non-Medicare retirees are paying. Now, over the last 2 years, more than 12 municipalities in Massachusetts have done this exact same thing, and with great success. We have yet to hear a single complaint from any of our local members who have been transferred into Medicare. Yes, there are always going to be minor differences, and there are pros and cons to everything, and those pros and cons always need to be weighed. But at the end of the day, what we have found is our members are far better off under Medicare than being stuck in the traditional health insurance plans and being forced to pay those huge out-of-pocket costs. So that's what we're focused on. That's what we're working on. I know I've gone on now for about 9 minutes, so I'm going to end this today. But thank you again so much for all the support that you give us. If you're watching this on Facebook, please share it with your network. Make sure you have liked our Facebook page in this post, but let your friends know our association is strength in numbers. The more retirees and active employees we have involved in these issues, the stronger all of you are going to be and the far better off you're all going to be. So thank you again.